to go ahead and get started. It's just a few moments after 1:30, and we definitely have a lot to cover, so we want to take advantage of all the time we have. My name is Teri Boughton, and I'm with the California Healthcare Foundation. I work out of our Sacramento office, and in that role, really try to bring resources to the Sacramento policymaking community to help inform some of the policy debates. The California Healthcare Foundation is an independent nonprofit philanthropy that supports ideas and innovations that improve quality, increase efficiency, and lower the cost of care. What we wanted to do with this briefing today is to provide a comprehensive but very high-level overview of at least 5 significant policy areas of federal health reform: prevention and wellness, expanding coverage through Medi-Cal and the health benefit exchange, community services for seniors, and healthcare workforce. We've invited experts on these topics to come and, again, provide high-level overview of these issues. We're not going to get into a lot of detail on these issues, and I tell you this to give you the opportunity now, if you were expecting a high level of deep level of detail on these topics, you may want to take your cookies and fruit and decide to do something else with the next hour and a half. This is going to be very high level overview. We will save time in the questions and answers section in order to give you all an opportunity to get your questions answered. The session is being videotaped, as you can see in the back of the room, so we're asking that you please turn your cell phones off because it interferes with the videotaping. We appreciate that. And also to let you know that, again, the content will be available on our website at www.chcf.org/Sacramento, and you'll be able to skip through to the speakers that perhaps you missed something and you want to refresh what was said. So don't feel like you have to take copious notes. You do have slides in your packet, and the video will be available middle of next week on our website. The last thing I want to mention is that there's an orange evaluation form in your packet, and we ask that you please fill that out and leave it with us today. You'll notice that there are a series of topics associated with much of what's being covered today, but also others. And we're hoping that you will give us your input on what more you would like to see in the form of a briefing like this, or maybe some other format, but more in depth on topics listed there, or anything that we haven't listed that you may want to suggest. So with that, I'm going to go ahead and introduce our panel. Our first speaker is Karen Shore with the Center for Health Improvement, and I won't go over her background because you do have all of the biographies in the packet. Karen is going to provide an overview of the federal health reform law, and then we will move on next to Janani, bear with me, Srikantharaja, and she is with the Prevention Institute, and she will be is a recent author of a community center health homes report called Bridging the Gap Between Health Services and Community Prevention, and she will be talking to us about the prevention and wellness provisions in the health reform law. After Janani, Gretchen Alkema from the SCAN Foundation, who has both federal policy and clinical experience, will discuss the community living assistance services and supports, as well as other provisions around supportive services for seniors. Did I forget Marion?
Yes.
Sorry. And I forgot Janet. I went out of order here. After Janani, we'll have Marion Mulkey from the California Healthcare Foundation, I apologize, who will discuss the Medicaid provisions as well as the health benefit exchange. And then, I should look this way instead. And then Janet Kaufman will cover the workforce issues. And Gretchen, as I mentioned already, will cover the senior supportive services issues. With that, I'll stop and let everyone get started, and I appreciate you coming today. And again, please fill out the evaluation form, and Karen, pass it off to you.